Welcome back, everybody, with me, Todd Eury. Todd, it's great to see you. Looking forward to seeing you this summer, too, in the coming
It's great.
weeks.
I tell you what, I have been in that way of thinking about our industry and not being able to see people that I look forward to seeing. So we went through 2 years of not really being with each other. So 2022 has been a back to the conference, world, and I've been taking advantage of that. I know that you and I are going to meet up at the Cardinal Health Retail Business Conference, the RBC, and that's going to be in
Yep.
Vegas. And then we're going to see each other again at Dr. Lisa Fast conference, Diversify RX, the Profit Summit, which is going to be in the Gaylord Grapevine, Texas. So I'm looking forward to both of those, Brad.
Yeah, no, absolutely. And boy, oh boy, I hadn't, it's amazing. You get out of practice and doing these conferences, and I'm doing, I don't know, 10 or 12 of them this year. So, but it's been exciting, and it's really been fun to see people that we haven't seen in a long time. So, um,
Absolutely.
well, we're going to do this, going to kind of a quick discussion. You and I have been doing this kind of, you're doing the pharmacy podcast, and where you get to interview all these amazing people. I've been doing this now for about 2 years, and we're getting the opportunity to, introduce or meet all these amazing people as well. And so today I wanted to just kind of talk about the trends that you and I are seeing so far in 2022 and, in the last couple of years, and kind of introduce those things and then talk about what should you be doing when you go to these trade shows. Yeah. So let's get started there. What are some of the trends you've been witnessing with and talking to, doing your interviews?
When I started the podcast, Brad, this would have been in 2009. The big trend at the time that was really coming to be was technology. It was pharmacy management systems going from the closed off databases that were built just for that piece of software to now being able to interface with packaging systems and consulting technology and what it's now known today. And it's not even a big deal. It was a very big deal in 2009. It's called open database or a SQL server or something that was open database that you could plug into. And that was really a big trend, and that was a change that people might not have realized behind the scene. It's making a big difference to a pharmacy operation, as well as from a practice perspective, watching community pharmacies grow, purposely grow, their long-term care and senior care business because they already had an established, trusted reputation in their communities. So they said, well, rather than unofficially being a long-term care pharmacy or a senior care or assisted living pharmacy, they set out to certify themselves and practice as a true long-term care pharmacy. And then as you and I have termed them throughout the years, we called those combo shops. And that was a really big, initiative probably between in the beginnings of that 2012 through 2018 period. And that's not really a trend today. That's the trend that I experience. Now trends are the world of consultancy. It's the world of pharmacy owners hiring young pharmacists or hiring another pharmacist to go out and to build their consultancy, to bring business to them rather than showing up and being on the corner between a gas station and a bank and location, location, location. That's not good enough anymore. It has to be very purposeful. So I see the trend of business development taking place and taking shape. And those are some aggressive, very intelligent pharmacy owners out there who are doing things on purpose to generate that kind of attention from primary care providers. And it's in so many forms. I could probably talk to you for 3 hours of the forms that that's coming in, but that's a huge trend is consultancy.
Yeah, and I'm seeing the same thing. In all of our climate, monthly climate events, we're talking to pharmacist panelists and experts, and we're constantly talking about clinical services. Specifically, we've recently been talking about remote patient monitoring, chronic care management, drug-induced nutrient depletion, all of those things, and so many more, as you said. I mean, you can talk about any one of those topics for hours and hours. But one of the things that I've noticed is, we track obviously very closely the number of pharmacies. How much has that changed? And it really hasn't dramatically shifted. There's a lot of people think that independent pharmacy is on its way out, and that there's a lot less than there used to be, and that's actually not true. The numbers haven't changed dramatically. They've gone a little bit down, but they're not dramatic. But what they do and how they do business, that has changed very dramatically. In the 23 years that I've been doing this, and that we've been in business, it's incredible the change. But when I look back to my parents and my grandparents, yeah, wow, it doesn't look anything like that anymore. So yeah, those are the kinds of things that I'm seeing as well.
I see the numbers change very, very slightly, and I agree with you. In 2004, there were about 22,000 independently owned community pharmacies out there. Now we're at a strong 19,400 plus, and they come and they go. And I think that is more about the demographic of our pharmacy owner than it is necessarily about the war that we're waging with how things are paid for and it being intense to the prescription rather than it being intense to the value or to the literal outcomes that pharmacists are helping patients reach based on the services that a pharmacist gives. And of course, it may not be the focal point right now, but it's quickly becoming the focal point that community pharmacy owners are looking for and are securing new revenue sources that give them an ability to give more services back to their patients in the form of, you've touched on these things: remote patient monitoring, supplement and consultancy to those supplements that, for example, erectile dysfunction. Well, if you start splitting hairs as a scientist and as a pharmacist, you start digging into people's diets, people's nitric oxide in their system, different things that are happening, how pharmacists are leading after meeting with their psychiatrist or the patient meeting with their primary care physician. Now they lead in chronic care management for the mental health initiatives, and how pharmacists are helping their patients deal with behavioral health issues, and how testing can come back to that. Testing is becoming huge in community pharmacy. We see blood testing systems through companies like Babson Diagnostics. We see pharmacogenomics in testing your patient's DNA and what they can or cannot absorb as designed. And we see immunizations and how that's expanding. So, Brad, if you're in the community pharmacy space and you're not getting ready to sell, and this is something that you feel that's thriving, and it's a big part of your community, and many times, more than not, your community pharmacy is the leading healthcare destination within your community. So having these other services attached to your pharmacy and building an educational-based reputation as a healthcare provider in those sectors that you want to dig into: supplements, PGX, immunization, pain management, birth control, family planning, fertility. I mean, there's a bucket, and there's no limit right now, which is the exciting thing for me as someone who hears from the experts. There is no limit into what a community pharmacist and pharmacy owner can do at this point in healthcare, more so than when I started in 2004.
Well, absolutely. I mean, you didn't hear about these things at all in 2004. The opportunities are immense, and I think that's the thing that I've really enjoyed having these panelists come on. These people that aren't just experts in saying, well, you should do this next. They're doing it, right? And they're wildly successful at doing it, and they're making money doing it. And they aren't focused any longer because they can't make money focusing on moving a pill from one bottle to another bottle. Right, those days are over. Um, and so you have to do the things that you were just talking about. And we're seeing very, very successful pharmacies doing that, but you have to evolve. And I think that's true in every business, right? You've had to evolve since you started the podcast network in 2009. I know in 23 years of doing this at RMS, we don't look the same as a company. We have to continue to change. If you're not changing, you're going to perish. And you mentioned you said if you're not getting ready to sell, but I would argue even if you are getting ready to sell, if you're not doing these things, the value that you're selling for is going to be dramatically less than the people that are. So unless you have it inked right now, you should probably still be doing these things that your listeners are hearing when they're listening to your podcast, and our listeners are hearing when they're listening to the panelists on our webinars.
That's very true. And I think where you're touching and what you're bringing to the table as a technology provider to the community pharmacy has taken RMS to a whole nother level. The intelligence and the people that you have coming on Climb, for example, really they practice what they preach. You're bringing on
Right.
people who have gone through the diligence of changing their existing business models in order to deliver something that's going to take them to the next level. And that's something that we should talk about, Brad. And it's not comfortable to change. I don't personally enjoy change. I do like talking about new things in pharmacy, so that aspect is good. But having to go from being a podcast to a public relations agency or to an electronic digital content development agency, that is expensive, and that is a huge investment that I'm making for the future for our publication and for our network, so that we're no longer the Pharmacy Podcast Network, we're the Pharmacy Publishing Network, and it's about publishing supportive documentation in the form of continuing education, in the form of business planning, in the form of collaborative study between physicians and pharmacists in order to become the next gen pharmacy that's going to be here and is going to continue to grow. And that in itself is the concepts of what Climb has stood for, which has been why we've been so excited to be partnered with you for some time. And it's why you and I choose the type of conferences that we invest in, because these conferences are so expensive.
Absolutely.
But it's so worth it when we go to organizations like the Retail Business Conference that makes things very intimate for their member and the types of speakers and education that they bring. And then, of course, Dr. Fast, one of my most favorite pharmacists out there, and how aggressive, she is as a pharmacy owner, but then the type of programs that she puts together. So I'll kick it back to you, Brad. Why are you and I so excited about what's happening in Las Vegas, July 13th through 16th, which is the RBC?
Well, I think that it's exactly what you're saying. This is an opportunity. I think sometimes people don't take this opportunity. I know they don't, because I talk to them and I'm like, are you going to RBC? Or no, I'm not going. I don't get anything out of those. The amount of education that's there, not just the CE stuff that they have to do to keep their license, but the amount of education on what their peers are doing to be successful, it's you can't miss these things. I like to sit through, I love these conferences myself because I learn something new all the time. And a lot of the innovation that we've done at RMS over the years has come from ideas that we heard at conferences, or even a new rule back in the day when HIPAA came about, and understanding and studying that and the impact it was going to have gave us the ability to do meds to beds programs for the hospital side of things. And, we've done the electronic signature capture when it first came out. All these different things, those are things we gained by attending conferences and talking to people about real problems and finding real solutions. And so I think it's when pharmacists go to a conference, they need to really look at the opportunities that the education gives them to learn what is working. Um,
Yep.
you can do CE online, no problem, um, and spend more time at these conferences networking and talking to people that are changing their business model. That's my suggestion.
So I think that it's also very telling and interesting that you've keeping your eyes and ears open to what was changing. The prep and the technology advancement of the RMS Mobile, where you could go outside and check out a customer, that didn't seem as important the time that it was released than the time that it was released and we hit the pandemic. And
Right.
it was like, oh my goodness. So those 2 to 5 years it took for you to roll out something that back then seemed almost novel or sexy technology, or hey, look at this thing RMS is doing. This is kind of cool. You can walk outside. All of a sudden the pandemic hit. It was no longer an option. It had to happen. It had to be
Yeah.
part of the infrastructure of a community pharmacy. That's the way that you think, and that's the way that the champions of our industry, our community pharmacy owners, they have to bolt into those ways of thinking. They have to take, what can I be prepared for today, just in case there's a issue or emergency in the future. And it's hard to look into a crystal ball per se, but paying attention to what's happening in markets outside of even pharmacy is sometimes very telling.
Oh, absolutely. And I think you're absolutely right. I mean, we attend all kinds of different conferences. We attend not as not as exhibitors, but we attend technology conferences ourselves to see new technology, even in different market segments, and how can we adapt that technology to our market and to the pharmacy market. And I think that's important, and that's what pharmacists need to be doing as well. What can they do to change, to change their business and adapt to the new world order, um, and use their expertise. And that's the other thing that we try to point out is you're in the usually the number one most respected profession there is in the world. And if it's not you, it's the nurse or a firefighter or a first responder, but you're always in the top three, and so you utilize that to help your patients. So
And I think you've followed a new formula that RMS has adopted in order to reflect back to the patient as almost like a guideline, saying to them, hey, when's the last time you took an evaluation of your buying group? Are they doing things that are out of the box than the average bear buying group, or is it always the status quo? Are they thinking of the future and changing? What type of clinical services are you offering? Are you focused on mental health? Mental health services today not only are no longer it can't be thought of as maybe something. It shouldn't be a maybe that you're going to deliver. You are the healthcare destination in your community. You have to have mental health services and mental health counseling connections to your community pharmacy that are part of the services that you deliver to your community. And then your remote patient monitoring plays right into that. And then your front end also plays into that, because now you're coaching our community pharmacies that things have to continue to change, have to be continued to refresh because of who we're competing with, as well as the perception of competition in your community. You might walk into an old-fashioned hardware store that they've done the same front end that they've done for the last 20 years, and sure enough, the customer base is slowly starting to dwindle off versus the other privately owned hardware store and or pharmacy that has redesigned their entire front end, that has that new look and that freshness, and it makes your community want to be a part of it because it's exciting to them. And then
yeah,
being able to understand the importance of catering to patients, to catering to your community where they are. And that means that an Austin-based community pharmacy might look different and act different and function different than a Pittsburgh-based or a West Coast-based or whatever. And that's true. Your
oh,
pharmacy
absolutely.
is a literal reflection of your community.
That's right. There is no one size fits all answer to any of this. You have to know your community, and that's what that's what pharmacists do now. They understand their community, and then now it's adapting your business to fit that community. So, well, Todd, we're out of time. So I very much appreciate you being with us today, and it's exciting. We'll see you next month, and you're going to be at our booth doing a couple of interviews.
Right. And we're going to be embedded in the RMS booth. We're so excited about that. If you are going to RBC, please reach out to the Pharmacy Podcast or RMS or both. You can reach us on Twitter. You can reach us on Instagram. You can reach us through LinkedIn. We're excited about this event, and we want to do something more for those attendees. So put us on assignment. Say, hey, I want to have a conversation about X. Skin dermatology, Brad, is a huge boom for community pharmacy. We just met Dr. Crystal Yee. She's from L'Oreal, and CeraVe is like a big, coming dermatology product for community pharmacies to tap into. And becoming a skincare expert, my goodness, there's a lot of new revenue in that, and it's in the best interest of your community too. So I can't wait to see you, Brad, and the team.
Yep. Well, thanks again, Todd. Have a terrific afternoon.
Thank you.
Bye-bye.